what does the model actually cover? How have we come to those conclusions? And the first thing to look at is that we've looked across three scenarios. There's the zero case, which is saying there's no change in the uptake of digital health. It is as it was in the start of the model. The base case, which is what we showed on the yellow line in the previous, which is saying, okay, well, what was our expected uptake of digital health in a pre-COVID scenario? And then the third, that was the orange line. The pre-COVID was the blue line. So the third, looking at the post-COVID landscape then and saying, okay, well, what does adoption look like in this post-COVID scenario? And as Amy mentioned, we've looked across our 5 key application areas to think, okay, well, how are these buckets actually changing? And in remote monitoring, we've looked at things like the old and vulnerable population in homes and care homes, those with chronic diseases, whether it's COPD, diabetes, or it's mental illnesses, the actual in-hospital remote monitoring of patients or things, so almost like an asset tracking, inventory management type use case. Within telehealth, of course, virtual consultations in both primary and secondary care, and the ability to book and manage appointments online. Within diagnostics and triage, looking at patient triage. So how effectively can you work out where a patient needs to go in terms of their healthcare system? Is this a GP or a specialist issue? Is this something you need to have an appointment for, or can this be fixed with a self-treatment or one-on-one? And then the diagnostics within the actual patient journey, and within data and analytics, looking at kind of EMRs and universal patient records, but also at a macro level, how can you analyze trends in healthcare to pick out things around drug discovery, drug cycling, patient trends in terms of being very proactive in terms of issues that they could be having. And the last one, which was kind of the personal health and consumer wellness side of things, we haven't modeled yet in the UK based on the global nature of the market. In the others, there's very clear, concise data, and it's very easy to segment. In consumer wellness, because of the global nature of the market, not only is the data less reliable, but it also has less of an opportunity, we feel, for the telecoms industry. I mentioned the fact that healthcare was very regionally and nationally bound was a very strong right to play for the telco. Consumer health and wellness doesn't have that national boundary, in the sense the internet and the global players can have much more of a role there. And so we haven't looked at that as a focus of this model, and we focused on the other 4.